I am Ariel Ingeno. I graduated with a bachelor's degree in nursing from the University of San Jose Recoletos. I work as a private duty nurse way back 2014 to 2015. I also work as a staff nurse in Changhua Hospital, Mandawi and Cancer Institute from March to August 2016. I am currently employed as a staff nurse in lying in clinic. The kind of people I work with in lying in clinic, there are those who have a leadership skills and some have managerial skills. Some are funny, some are grumpy, some are happy-go-lucky, some are intelligent, and some are average. Even if we have different personalities, there is one trait that we all have in common, and that is workmanship. We all do our best in the things that we do in order for us to deliver the care that our patients need. We serve patients who are ill and those who have diseases. We also cater to pregnant women, patients who are about to undergo surgery, and those who are about to take their last breath, people who are about to die. My colleagues are my fellow staff nurses, also the doctors and pharmacists in the hospital. What I enjoy most about my job is you get to meet a lot of people in the different walks of life. You'll learn from them and they will also learn from you. Also, the best part of being a nurse is seeing your patient recovered from a traumatic disease. A thank you from a patient makes our hearts move. It really feels like heaven seeing them continue to live the life that they have used to have, even if some thought that their status are far from possible to be achieved. In the nursing field, activities in a typical week varies, but the routine activities we do every shift are the major endorsement. Wherein the outgoing and incoming charge nurses and staff nurses are going to talk about each patient and their illnesses and diseases. We also include the laboratory and diagnostic tests that has been performed or are about to be performed for a particular patient. Also special endorsements that we need to watch out for a particular patient, like if the patient's blood pressure is more than or equal to 160 over 100 mm of mercury, we need to refer it immediately to the doctor. After the major endorsement, we are going to have a rounds, which means the charge nurse together with the staff nurses of a particular shift are going to see each patient to know their concerns and status. In this way, we know what to expect from the patient. After our rounds, we are going to prepare the medicines that we are going to administer in a particular time. After preparing, we are going to each patient to take their vital signs, give the medicines, ask for their concerns, and if a patient needs to be fed, we are going to give a milk feeding and administer it through the nasogastric tube or NGT. After we have administered the medicines or feeding a patient, we are going to write our nurse's notes. A nurse's notes is a written output that talks about the focus problem of a patient and important procedures we have done to our patients in our 8-hour shift. Other than writing our nurse's notes, we also do other procedures like providing bed bath, do oral care, and a lot more. We work 40 hours a week, but there are times where we need to work 12 hours, especially when we are understaffed, so it would be more than 40 hours a week. The most important skills in our field are both communication and problem solving. They go hand in hand, especially when you are going to assess a patient's health status. Like for example, a patient is complaining of pain. You use your communication skills in order for you to gain information from your patient. You need to ask them the location of the patient, the intensity of the pain, the quality of the pain, things or actions that make it worse, and what treatment did he or she did to alleviate the pain. From those information you gathered, you need to use your problem-solving skills to come up with the right nursing treatment to be done. A challenging situation? Well, there's this one time when I handled a bedridden patient who was on a nasogastric tube. Not only that, she also needs to be turned to side so that her bed sore will not worsen. She also needs to be fed every 4 hours with a milk formula through the nasogastric tube. I am also responsible for doing oral care and bed bath to her. I also give her medication that she needed. What's more challenging was that she wasn't the only patient I was caring for at that time. I also had other 7 patients to cater. The relationship I had with my patients are a mix of a caring and professional relationship. Caring in a way that I render care to them, like providing bed bath, and professional in a way that I need to stay calm despite of my patient's irritating attitude. The classes you need to take in high school if you want to pursue my career is science, biology, chemistry, and psychology. Those are important in the nursing field, especially science and psychology class. Extracurricular activities, perhaps you need to pursue activities that is in line with service team, like food programs or cleaning programs. Under healthcare professionals, I work with our doctors, medical technologists, pharmacists, and radiological technologists. I am interested in this particular field because I am fond of serving other people. It makes me feel more useful whenever I get to serve other people and hear them say thank you when they are discharged from the hospital. The classes you need to take in high school if you want to pursue my career in science, biology, chemistry, and psychology, those are important. That's all. Thank you.